Dr. Lillian I was a healthcare hero because she has incredible energy to deal with everything to do with infectious disease. She does unbelievable research, and frankly, over the last 3 years, her knowledge has been extremely invaluable. Early on, when no one knew what was going on with COVID, she was out there researching and talking to people in China and Italy, and later New York. She actually determined that intubation early on was actually a negative to the patient. She, at the time, became not only a great advisor to us, but she was an advisor to the mayor, she was an advisor to the governor, and many times she was on national news as to the things we were seeing. She stayed the course and really tried to make sure everybody stayed calm and understood what was happening and how to deal with it rather than just running crazy like other places had done. Her leadership, I believe, saved a lot of lives in South Florida. As COVID has shown us, where diseases can spread in a matter of days, if not hours, having an infectious disease person in an entry point like Miami is extremely critical. So having Lillian at Jackson and working with our emergency management people are extremely important, not just for South Florida, but for the entire country as we see any potential dangers in the future.
Dr. Leyva is a healthcare hero because of her compassion, her dedication, her patient advocacy above all. She works in end-of-life care. She's been at VITAS for about 6-7 years as regional medical director, and what she has brought to our programs in the sense of not only quality, but also the processes that she's looked at and almost perfected just blows my mind. When patients and or family want their loved ones to die at home in their bed, surrounded by their loved ones, it becomes our mission to try to do it and do it well. And she has assisted us in being able to provide that with physicians at the bedside, respiratory therapists at the bedside, delivery of the equipment, making sure that medications are available and ready to go so that the patient's passing is as symptom-free as possible and that the family is available and there for that moment. I've rarely met someone that advocates for patients and families the way she does. Her tenacity, her compassion, and her dedication, and that is why I nominated her for a healthcare hero.
Sandra Severe is a healthcare hero because she not only led our community through a very tough time through COVID-19, but she remained very active in her community. In March of 2020, our community and our world experienced a global pandemic. Dr. Severe was the executive lead for Jackson on COVID-19 lab operations, in which what she created became a model for other hospital systems during the COVID-19 pandemic for not just patients, but also physicians and volunteers in order for us to really get a handle on COVID-19 in our community. In addition to her role as Senior Vice President and Chief Executive Officer, she's also an adjunct faculty at FAU, a guest lecturer and a panelist with FAU's College of Business with their Master of Health program. She's also a professor at the Nicole Wertheim College of Nursing and Health Sciences at FIU, which is her alma mater. And so she's been able to really impact not just her incredible team at Jackson North, but also students who are aspiring to be, nurses and hospital administrators in the health sciences field. Sandra is the daughter of Haitian immigrants. Born a year after her parents arrived, she was able to, really create this full circle moment in becoming the very leader of the hospital where she was born. By very definition in what she does, she is her parents' dream.